revealed a secret here when it came out.
Yes.
When people first meet you, what do they always say to you? You're so
Tall.
Yeah, yeah, yeah,
Super tall.
yeah. Yeah.
Super tall.
I like to say I'm at the upper border of normal.
Upper border of normal. Okay.
Anything over 6'5" is
Now
abnormal.
you're about 6'5", right?
You're
6',
6'5", right? Yeah.
Okay.
How many people asked you for advice when you walked in the building today? Like, how many people said to you, something's wrong with me, what about this?
Well, I have a mic on, so nobody's talking.
But I mean, that's the thing. That's our topic that we're talking about, is that whole thing. I'm sure people here in this building, people you meet at dinner parties, your family, your friends, everyone needs advice and prescriptions, right?
So they did a study, and 99% of doctors said that they're routinely asked for medical advice. And it could be, you know, diagnosis, it could be treatment, it could be advice on who to see, where to go, all of those things. And what's fascinating is that it's hard because it's a social sort of nicety to be nice to people, right? So somebody comes and says, you know, I have this problem with my ear. It's not my expertise. That's not what I do. But at a party, they'll say, you know, my ear's been clogged for, you know, 3 days. What should I do?
I talked to you about my nose.
Right. So, but, you know, in your case, we advised you to go see somebody who's a specialist. But if we had a party and you're asking me something, I'm obliged to give you some answer, right? It may be an off-the-cuff sort of, you know, oh, it may be just wax in your ear, but it could be something much more serious. Now, I say, oh, it could be just wax in the ear. You're like, oh, I asked a doctor. He said not to worry. So it's this sort of difference in perception.
But it gets deeper than that, Dr. A, because there are family members who come to you as your family member and want you to operate, want you to write the prescriptions, want you to be the physician. What do you do then?
So I've had two instances. My aunt and my uncle both needed surgery, elective surgery, that I do, that I'm very good at doing. And I referred both to somebody else that I trusted. I said, I will help sort of guide you.
So ethically, you think it's wrong?
I think so.
But more and more people are doing it, though, because it used to be never you did it. And now, but I think more and more are,
You know, it becomes very complicated. There's issues with privacy, right? So when you're involved in your relative's care, there may be things they don't want to tell you. Right?
And they may not tell you.
And there may be things you may not want to ask. There may be things you don't want to examine.
Okay, now, different scenario.
Yeah.
You live in a nice town, 25,000 population. There are 2 physicians in town. They're all related to the whole town. What happens?
So that's the dilemma, is that when you're in a smaller place where you don't have the option of sending somebody to someone else who is as good as you are or better, then the recommendation is that you do it if it's urgent. If it's not urgent, you try to find some alternative way you can either send them to somebody who's, you know, in another town, close by, another person who practices, but some places it's just not possible.
And where, in terms of the, let me use a big word, the consanguinity tree, do you stop? You're saying aunt and uncle. You know, you're talking about wives and children and husbands, etc.
That's a
cousins, aunts, uncles. Where do you stop?
I would say immediate family, no. Close friends, no. You know, then it's a matter of judgment. You know, how far do you extend that? I try not to do anything for anybody who is close to me in terms of, you know, let's say something goes wrong. It's not your fault, but something goes wrong. That complicates your relationship with somebody. So if you have a relationship that you value, it behooves you not to complicate it.
But also, it works
them.
the other way around. If you're a family physician, let's say, or you're a general practice or an internist, over 30 years, you become very friendly and close with your patients because you see them over and over again. They become part of your circle.
So, I mean, you know, medicine is a very, you know, deep relationship, right? The physician-patient relationship is very dear and goes, you know, to an extent that you don't share things with other people. So, yes, inherent in that is that trust and relationship. But, I mean, if you start as a doctor-patient, you make it a deeper relationship. But if you start as a deep friend, perhaps you should be a little wary of
some doctors think they're not going to let anyone cut on their children or their wives other than themselves.
Here's the more important thing, is that if you do end up treating a friend or a family, make sure that that information is relayed to their primary physician, right? So that the care can be complete. Because oftentimes you'll help someone and the doctor never finds out.
The whole website. A lot of people will go to websites to get information on what type of doctor they should see for their children or their family members instead of talking to their own doctors or friends. They trust strangers. I don't understand.
So they interviewed 1,600 parents who had a child less than 18, and they said, if your neighbor, a trusted neighbor, said, listen, you know, I have this pediatrician who's been taking care of my child for a long time, has done great with us, you know, you should really, you know, have that as your pediatrician. And these people went on a website and they got 3 reviews. One was no review, one was a good review, and one was a bad review. Would those reviews sway what they did? And the answer is yes.
So they'll take some wackadoodle's opinion
on
a doctor as opposed to someone they
Because if you're dealing with your child and somebody says, this guy is horrible,
right.
Even if you think it's a wackadoodle, you get scared, right?
So that's the thing is,
a wackadoodle.
We have no background on the people writing, right? They could have, issues of various kinds that we don't know. They're not people we trust, right? They're people who are writing reviews. A lot of the times as doctors, we see people who are unhappy who write reviews. People who are happy just expect that should be normal, right? There's no reason to say this is good.
It goes to products and restaurants or anything else.
Exactly. So, this prompted me to go look at my reviews. I was like, oh, what are people saying about me? And,
Don't ever look at what people say about you online.
But
it's never good.
But it's fascinating because the one person who wrote something negative had to do with the office and somebody told him something,
but it
had nothing to do with me.
But that gets weighted. That gets weighted so high.
But people get upset and they write things, and people believe that those are true.
Well, also people will go to physicians they see on television, which is another thing we can talk about.
Don't trust anything.
Dr. A, thank you as always. Thank you very much.
What was that word?